So now the next speaker, but we have many questions on the website, and we will speaker, we share with you at the end of this, after the three speaker. Now is Antonio, is your time. Antonio, Professor Antonio Massa, he will present sunscreen in acne. How to explain how it's so important to know that. Please.
Okay. I'm presenting our city, Porto. It's a World Heritage City. If you want to come, surely you will be welcome, and I will have some time, if in advance, to visit the city with you. It's really a quiet city with good food, good wine, and a very reasonable price. I want to say thank you for this invitation to the heart of IMCAS, Dr. Benjamin Asher, and also to this our presenter, Hugues Cartier. It's an incredible organizer, and it has a heart, a very sweet heart. It's a very sweet person, and much more objectives. I also want to do as Marco with Ukrainian. We are organized and we are sending many medicines, drugs, and others, food and clothes. We did it. And we pass in our newsletter, and also to control front doctors, they are sending a lot of our things to Ukrainian. It's a pity. I'm not a politician, but I have to be with them. Everyone has to do it. Marco showed how are the physiology, but I stay in the small parts. I have to remember that we have to maintain always and always the follicular ostium open. So at night, we need to use creams and gels to get it. However, this may cause scaling and dryness. It's normal. And I have a sheet to give to the patients where I saying to care not to put too much. And in a general way, I suggest to my patients to wash face with water and soap. That's all. And to use a makeup remover. What kinds? A milky or cream or micellar water. Avoiding gel. Why? Because the gel may dry the skin, and I cannot use so much the efficacy of the creams that we are speaking, and all of us we know, and I put the main ones on this night. I suggest also to put creams half an hour or even more, 1 hour later, about the skin is dry. For what? To avoid irritation. And so appears here the sunscreen. I think I am using sunscreens from the 90s, usually in milk or cream. Usually, very rare, I can use another one, gel or other ones, but milk and cream. And why? To give some more moisturizing to the skin on these patients. And finally, they can put a makeup. Doesn't matter which ones. The creams that I suggest at night depends on the type of skin. So when they ask me to send, to accept, to make a call, to make a conversation, a video, I said no. I have to see the patient, and I only treat face-to-face patients. That's my position. Tretinoin, benzoyl peroxide, adapalene, trifaraten, azelaic acid. I also use always, but mainly in pregnant or people that before that they want to become pregnant, or they are support some babies. And you have a lot of cosmeceuticals that sometimes I use, and also combinations. But in reality, I never use topical antibiotics. All these creams, they make those peeling and make skin thinner with sometimes irritation, where we can use hydrocortisone or even a little bit stronger for small times of time. This is a view different from our city, with boats going along the river, and when you visit, you will enjoy surely our city. About sunscreens, some details that I feel that are very, very important, and I believe they are very, very good, and they support all the other things. So in the morning, always, and only sunscreen. Which ones? Depends. And sometimes I'm used on two levels. One for oily skin, another part for dry skin. I have to say that usually I test and I have in my face during the 3 different sunscreens. And so I can choose the ones for oily skin, the other one for dry skin or medium. I'm doing this one from many time ago. And it is in reality improves the results and welfare of our patients. A second point is to apply massage, 2 or 3 layers. Why? Because to have a solar factor protection, as they suggest, 50%, 50 plus, it's necessary to put more than 1 layer. And in massage, to avoid that, to go to other parts, to the eyes, to the mouth, and to fix in a certain point. How many times? 3 times per day. Not every 2 hours, but usually when they wake up at 8, more or less, at 12, and in summer at least also at 4 p.m. 2 or 3 layers, repeat, on the face. More times if they feel the face dry. Why not put a cream, a moisturizer? Not necessary. Sunscreen is even cheaper for the patient, and it's much better. They can apply makeup on top, but they can do it several times. Every time they put the sunscreen, after that they can put the makeup without washing the face first. It's a good way and very, very useful. Also, I suggest to use a lipstick several times a day, mainly after meals, after breakfast and lunch, and more times, mainly if they are using isotretinoin. But I suggest to do it on the everyday practice because they are much more effective. What else about sunscreen? 50 plus. It's only this one that we have, only if we put 2 milligrams per square centimeter. There are works mainly from Fernando Stengel and others that they put in such a part, not whole face, and compare if you use half quantity, 1 milligram, it means that you could have a sun protection factor 25. No, it could be 12 or 15 or 13, something like that. Also, in Australia, they did it in the streets, and they could see that, in fact, using 50 plus, the reality, the protection factor, it was not so high. Lower, it's smaller layers. If we put in small layers, in 1 layer or 2 layers, the sun protection factor is lower. It's not so useful, and could see it mainly when you have a melasma. Sunscreen, I say to my patients, I repeat, that is a moisturizer enough and good to control the dryness that they can have on the face. So, suggestion is apply, apply, apply. And they will use a lot of sunscreen, and with great benefit for them, and also feel a very good feeling for us. Some food to a break. Octopus with potatoes. This is one of our dishes in the city, and we can taste soon when you want. In summary, sunscreen when waking at 12 and at 4 p.m. Sunscreen is an enough moisturizer. Suggesting also the patient, and on sheet I do it, using several layers in massage. Pay attention if it's oil or dry skin, because it's different one and the others. I have my own choices. So I want to, and I know, and I want to say to use one or others. Using so many years, I can say with great success, no doubt. And so I accepted to do this job, and I feel that is very important and very useful for everyone. Once again, this is a meeting that we organize. Next time will be 1st and 2nd of April. If you are close, it means Marco or Real, you are welcome. Only to tell me in advance. We offer the fee, and Friday and Saturday meal with us. Only to say, and also if the assistants they are interested to come, they are welcome. We have a lot of Portuguese there. This is a bottle that we make on the front about meeting, on back with program into lines, and so we will have 12 speakers. One of them my great friend use. Thank you again for our follow. I hope it could be useful. I learned with Marco several times, not only now, and we share some things, some ideas. Thank you for all.
Thanks, Antonio. You are incredible. Yes, I see my name on the bottom. Everybody know that one from Porto is not alcohol. Just to mention that, thanks a lot, because I like your idea that you prescribe at any time, every time something, because it's the first time I see this kind of thematic. So we need to use a sunscreen for any patient who have acne. Where I live in north of France, it's not really sunny. Okay, so for me it's a surprise. But Antonio, 2 questions. Do you prescribe to reduce hyperkeratosis? Too much keratin, because we know that if you put your skin under the UV, you promote the keratin and you increase the eye black. Or the second point should be, if you prescribe sunscreen, is to reduce the photosensitivity of your topical cream like peroxide, or maybe to reduce sensitive skin when you use vitamin A acid. The reason it's for what? To protect the microbiota, to protect from keratin, to protect from the side effect of your topical drugs. Explain to us, please. Why? Where your idea is come from?
It's in reality, I said and I told and I repeat, at night, creams to treat acne, it doesn't matter which one I use at night. So So photosensibility, nothing, never. And the sunscreen, it's a moisturizer that is always, I suggest my patient to use every day. Summer or winter, doesn't matter. Because they, in reality, are very good moisturizer. They make an excellent hydration. And they preserve also keratin, and they preserve everything. I can tell you that in reality, the patients feel much more comfortable. And when adult acne, you know, these people, they have to be in front, other ones for selling usually, or for self-esteem, to feel better. And the sunscreen complete all this welfare, all these in these cases, the complement that they need, using and putting more and more. And I say, doesn't matter if I'm using adapalene or benzoyl peroxide, doesn't matter. They will feel well. And I tell them, please, if you have more lesions, take or apply a second or even a third layer over the lesions, and they will disappear quicker. And if at night we put these creams that all of us use, we need in the morning to compensate, to repair the skin using more and more sunscreen. This is principle. And surely after the 90s, I've been using for the everyday practice.
Okay. A comment of my other colleagues, Professor Alan Mian. What do you think? Do you prescribe sunscreen for acne? You live in Cairo, in Egypt. More sunny than also France. Professor Marco, you live in Sao Paulo.
Yes.
The same problem. Explain. Do you prescribe?
For me, in Egypt, the people are of darker skin types, and sunscreen is very important for them to avoid the PIH. But unfortunately, they are not compliant to it. They use it in small amounts, in very small amount, and they don't use the suitable type for their skin. And that's why we sometimes face PIH. But we make them know that it's very important part of the prescription to use the sunscreen properly.
So it's not really a problem of price. Is it expensive in Egypt to prescribe sunscreen, or it's very common?
There are many types. The good types are somehow expensive.
And you, Marco, is it common for you?
Yes, it's common for all patients in Brazil. We have a lot of PIH in patients, so I prescribe for all my patients sun protection. And I think it's a good tool not to help the improve of hyperpigmentation, but also to prevent the hyperpigmentation process. So I prescribe every day. And in Brazil nowadays, we start to use sun protection with color, with tinted, because we know the blue light action that this radiation make the skin pigmentation worse, the blue light radiation. So yes,
but the blue light kills the natural light.
Yes, we have this balance, but because we have so much hyperpigmentation, we prefer to reduce the blue light action in the skin, reducing the PIH or prevent the PIH, than using this radiation to reduce C. acnes. So I understand you, Cartier, but in Brazil, with so much days with sun, our option is to protect the skin with sun protection every day with color to prevent PIH.
Okay. A question about, for you, Antonio, isotretinoin treatment, which is a question from Seng Shumurung from Cambodia. Physical or chemical sun cream, which one is the best for you after post-isotretinoin treatment?
Okay, thank you, Dr. Sang, for the question. I usually use chemical, always, always. I think it's not necessary to use physical. They are not so agreeable. And if you apply chemical, 1, 2, or 3 layers, doesn't matter, you will get a very good result.
Yeah,
I don't remember to have hyper or more rarely hypopigmentation. No, the patient stays and go on improving with time. Believe me, I have also many patients. I think it's my more frequent pathology, acne. You know, if you have advantage, if you get good results, one patient take another one to you.
Okay.
And I'm only now.
For all of you, which kind of sunscreen you prescribe? With titan, but when you have a dark skin, if you put the cream, white sunscreen, patients are something not very happy. So you prefer maybe to use a classic sunscreen. Which kind of product you use, titan or not titan? Like for kids or for adults? Marco, Nehal?
For acne.
Yes, for acne. Which kind? Because
I prefer to use.
Some of sunscreen are white. Imagine where you have a phototype like 4 on 5.
In the form of gel or cream. I prefer this form for the oily skin. And sometimes for the reapplication, I prefer spray because it's more practical for them to carry the spray with them.
Marco?
In Brazil, we use an oil-free lotion or an oil-free cream.
Antonio?
No, I don't. It's not necessary to use an oily because I choose them. I test them before in me and friends, that people that is closer to me. And so we can see during weeks which ones to use in one case and another case. I think, in our opinion, it's not necessary to use an oil-free because they go on, doesn't matter if after acne, post-acne. We have the good results and they will go on with creams because to maintain follicular ostium open, we get it, doesn't matter with these ones, but also with cosmeceuticals. And so in the morning, I don't need to have this care.
Last question for you, boss.
For Dr. Carmina,
Yes.
Carmina.
Austria.
Oral or topical sunscreens, always, but nearly always, I use topical sunscreens. I said it works also as a moisturizer. It's my hydrating, special, good, cheap cream. Good, always. Do it, please.
Okay. From Brazil.
No, Dr. Shirley. I know some Shirleys from Brazil, so it's a very common name. Are there cases which are necessarily moisturized besides sunscreen? No, I never do it during the day. I can use a moisturizer at night, and if the skin is fair, is thin, I use usually a moisturizer also. I choose and I have control with them, and I know them very well because I'm repeating. Yes, I'm repeating. Sometimes I'm moving, of course.
Okay,
They disappear.
Marco, you agree?
Sometimes, my friend. In Brazil, we have many patients with sensitive skin. So I use to prescribe sun protection in the morning, and 10 minutes before the use of my topical medication at the night, I prescribe some moisturizer, and it's very important to use a soft cleanser like a Syndet to cleanse the skin, because this combination is very important to support the tolerance of the skin, take care of the skin barrier. So for me, sunscreen in the morning, and for sensitive skin, a moisturizer 10 minutes before the use of my topical drug to treat acne.